Hello, I'm Dr. Elizabeth Coyne. I'm just going to talk about assessment item 3 for 7202 NRS. So this is the last and biggest of your assessments, and this is really that accumulation of what you've looked at in A1 and A2. So looking at sort of what their advanced practice role was, looking at an area for practice change, and now you're actually developing your change management plan with your advanced practice role included. And so we're designing a clinical practice change. And so looking at sort of how this could be developed in your clinical area and what sort of management plan you'd use. So as you're going through this, we know that you've explored and completed your environmental analysis. This may have included patient or staff surveys, general feedback. It may have been in relation to staff mix or patient outcomes, complaints, or some of your aspects of annual monitoring. Think about what framework you used and what you found and what your recommendations was, because this is what then builds your assessment item for this A3. So you need to think about what was your current practice, what is best practice, and what is the research that would support that, and sort of the national frameworks, what the suggestions are. So when you're looking at this assignment first up, you've got to sort of discuss and justify your practice change and why how you like to implement it into your practice area. And look at what you looked at in recommendations from A2. Think about your types of framework and make sure it works for your ideas. So then you need, the main part of this assignment is this discussion of your plan. So you're looking at how you're actually going to put this plan into place. And so you want to write first an outline, making sure it's looking at that criteria. Think about your supporting research and just being aware of this word count. So about 4 paragraphs, 1,000 words. Making sure that you've got your stakeholder involvement and what their contribution to this project is, and who are the key players and how you're going to motivate them to actually engage with your plan management change. Look at your timeline and make sure it's really achievable and around a reasonable timeline. So thinking about meetings, follow-up, and definitely including on that the evaluations, which is worth a fair bit of the marks as well for this assessment item. Think about the legal and ethical influencing factors. So, you know, what do you need ethics to do your assessment and change management practice? Do you need to have the senior management involved and okay this change? Did the medical profession need to be involved in this change? What are some ethical issues? Is it in relation to patients or staff? And your minority group concerns. So this may be staff minority, it may be patient, non-English speaking, it may be cultural, it may be you know, just that it's female and male. Is it a minority group that has needing further information? And so you can really sort of look at this in relation to your idea and just including that. It's not a big area, but I think you need to be aware of that you'll have minority groups and that how do you actually include them in this change management plan. And then evaluation is a really big important part of any change management, because you need to be able to identify and justify that you've actually evaluated, it has improved it, and it has been able to be sustained. So you need to propose this in your method, make sure it's included in your timeline, and think about ways to sustain it. So you may look at sort of this behaviour modification, self-efficacy, self-management, and include that in your sort of theories of change to justify your evaluation. Make sure you also have research to support this, so that it's not just your ideas, but it's really supported by your research. So your overall presentation needs to be, has also worth marks, and so think about your introduction and your way you conclude your assignment. Make sure you're got sort of, it's definitely got good flow and you've got inclusion of research throughout. Be consistent with your headings and making sure that each point leads to the next one. So past ideas have been looking at patient flow in different areas, privacy in waiting bays, hand washing and the sort of use of hand washing bays and gels, medication rounds, interruptions, how you actually get that information in patient education. And so there's such a range. And so think about that in your area as you're starting in A1, and look at that sort of how you're going to build this from A1 to A3. Make sure you have a clear introduction of your concept at the start and then flow of that through the essay. Thank you.